Jessica, and I'm going to be your nurse today. Can you tell me your full name?
Kelsey Ramos.
Okay. And I'm just going to wash my hands, do my hand hygiene, and put on some gloves. So can I get your wristband? And can you tell me your birthday and your MRN number?
21894 and 54321.
Okay, great. That matches the chart. So, do you know where you are?
Brandon Hospital.
And do you know what day it is?
July 21st, 2021.
Okay, so my patient is alert and oriented ×3 to time, person, and place, and she does not appear to be in any distress. So, so the first thing I'm going to do is assess your IV. Okay, any tenderness?
No.
All right, and there does not appear to be any swelling, redness, or erythema. And I'm going to flush it. It's not infiltrated. It's working well. There's no kinks in the tubing. So that is all great. Okay, now I'm going to assess your hair, skin, and nails.
Okay.
All right, the hair is clean and neat. There is no abrasions, redness, or rashes, or skin breakdown on the scalp. I'm going to assess your skin on the arms and legs. Your skin is warm and dry. The color is normal for ethnicity. There is no skin breakdown, rashes, or lesions on your legs or your arms. I'm going to assess the skin trigger. There is no tinting. I'm going to do the capillary refills. And they are less than 3 seconds. So the next thing I'm going to do is look at your nose and throat. So if you could just, let me see your ears, just the external ears. Alright, there is no skin breakdown, rashes, or lesions. The next thing I'm going to do is assess your eyes and pupils. Okay, if you can just follow this. Alright, and then I'm going to just shine this bright light. Just look straight. Okay, pupils pupils equal round reactive to light and accommodation. I'm going to assess the sclera and the conjunctiva, which is normal. Now I'm going to assess your nose. If you can just tilt it back. No drainage, membranes are moist. And if you can just stick out your tongue. Okay, mucous membranes are moist and pink as well. And then smile for me. My patient's face is symmetrical. Okay, so the next thing I'm going to assess is your respiratory system. Are you having any trouble breathing?
No.
Okay, and my patient does not appear to be in any respiratory distress, and she's not using any accessory muscles to breathe, and her rhythm seems regular and non-labored. So I'm going to just assess the lobes. If you can just turn around for me, I'm going to open this gown up just a little bit.
Okay.
And then whenever you feel my stethoscope on you, just take a deep breath, okay?
Okay.
Great. All right, all lobes are clear. You can sit back now. Now I'm going to assess your cardiovascular system. So the first thing I'm going to do is just palpate your pulses. I'm going to start with your carotid using one hand. All right, now your radial and your pedal. Okay, pulses are normal, no bounding, no thrills or anything like that. The next thing I'm going to do is listen to your carotid. Alright, no bruits. And I'm just going to palpate your PMI, PMI, which is in the fifth intercostal space midclavicular line.
Mm-hmm.
No heaves or lifts. Okay, and now I'm going to just auscultate using my stethoscope, the diaphragm, and the bell, your heart sounds. I'm going to do the aorta first, which is the second intercostal space, right sternal border, your pulmonic, which is the second intercostal space, left sternal border, your Erb's point, third intercostal space, left sternal border, tricuspid, which is fourth intercostal space, left sternal border, and finally the mitral, which is fifth intercostal space, midclavicular line. Okay, so first I'm going to listen with the diaphragm and then the bell. I'm going to just pull this down. Right, and then I would just listen to the mitral as well. Like I said, fifth intercostal space, fifth intercostal space, midclavicular line. And all the heart sounds were normal rate and rhythm, and no additional heart sounds were auscultated. So the next thing I'm going to do is assess your gastrointestinal. So when's the last time you had a bowel movement?
This morning.
Okay. And was it normal?
Mm-hmm.
Yeah. Okay. And any complaints of nausea, diarrhea, or vomiting?
No.
Okay, perfect. So if you can just lay back for me.
Okay.
I'm going to lift up your gown just so that way I can inspect your stomach, your abdomen. Okay. I'm just going to kind of pull this up just a little bit. Okay. So I'm just going to inspect it. Patient's abdomen is normal in size. It's symmetrical. I'm going to auscultate all four quadrants and listen for bowel sounds.
Okay.
Alright, bowel sounds are present in all four quadrants. If they weren't, then I would listen for 5 minutes in each quadrant. And now I'm going to auscultate the aortic using the bell of my stethoscope. Alright, no bruit present. And I'm just going to palpate, feel around. First I'm going to just do a light touch. Let me know if you feel any tenderness. Any tenderness? No. Okay, and now I'm going to do a deeper feel, okay? Alright. I did not feel any masses. There was no guarding or tenderness present, and everything sounds good. So if you want to sit up again for me. When is the last time that you urinated?
About an hour ago.
And how often do you urinate?
Like 4 to 6 times a day.
Okay. And have you been urinating more frequently than usual?
Mm-mm. No.
And the last time you went, was there any issues, burning, pain?
No.
Okay, perfect. And while you're here, I'm going to monitor your I's and O's. Since you don't have a Foley catheter or anything like that, I'm going to just monitor it by every time you go to the bathroom if you can pee in the hat. Okay. And then I'll just measure it by that amount. And, okay, so now I'm going to assess your extremities, just your arms and legs, the strength. I'm going to kind of get into view of the camera here. Okay, if you can just hold out your arms, squeeze. Perfect. Now if you can just push on my hands, and then kind of try and, force against me. Okay, yeah, perfect. Okay, and how are you experiencing any numbness, tingling, or swelling?
No.
Okay, so extremities are 5 out of 5 for strength. And are you in any pain at all?
No, I'm not.
Okay, and I would also take your vitals, and that would be part of your assessment. I'm going to take your vitals, and vitals are all within normal limits.
Got it.
Okay, your bed is in the lowest position, the side rails are up that need to be up, and your call light is within reach right here, and your belongings are all within reach as well. Is there anything else I can get for you?
No, you were great.
All right, we'll just hit the call light if you need anything.
Thank you.
You're welcome.